All right. Hello, Mr. Marek. Thank you for joining us. We want to take a moment to spotlight what you all are doing in our community. Before we get started, I'll introduce myself to the virtual world. My name is Patricia Sullivan. I serve as the communications manager with Darlington County First Steps. And I'm so happy to be talking to a dear friend and an awesome partner. I'll go ahead and turn it over to you, Mr. Marek, and you can introduce yourself and tell us who you represent and the mission of your organization.
All right. Yes, my name is Marek Calhoun. I am the Director of Social and Community Services for CareSouth Carolina. CareSouth Carolina is a federally qualified health center. We operate our service areas, the PD region. We service Darlington County, Chesterfield, Marlboro, Dillon, and Lee counties. As a federally qualified health center, we're a medical service. We're also what we call a safety net service. So, which means that we have programs and services available for individuals who are uninsured or underinsured. But we also serve as a medical home for anybody, whether you are insured or not. So we just don't service uninsured or underinsured. We service anyone: private insurance, commercial, work insurance, Medicaid, Medicare, any type of insurance. But we do have programs and services available for individuals who does not have insurance or underinsured.
Wow, so you make it possible for everybody to get their health needs met. That is awesome. I mean, that just sounds like removing barriers. You remove barriers and make sure that everybody has the same opportunity to be helpful. So that is awesome. Care South is amazing for that. All right.
Absolutely.
Yes, sir. Yes, sir. So the next question I want to ask you, we all have experienced the same thing, and that is the global pandemic. I want to know, how has Care South adjusted, and what have you noticed it's done amongst your clients? How has it impacted your staff? Just tell us, what adjustments have you all made at Care South?
So yeah, so just like any organization, we had to kind of adjust on the fly. But we had some processes in place that we were already working on that we had in place. It was just we hadn't initiated it fully when until the pandemic hit, and it really is kind of a blessing and a curse in the way I say that, and I tell people that, it was like, but but what it did was it kind of forced us to move that timetable up quite significant. You know what I'm saying? And I'm talking telehealth. We've had to adjust from seeing, because folks stopped coming in, and we didn't want them in until we've really fully understood the what the pandemic, the coronavirus. There was very little information early on. So what we had to do was adjust and move up our timetable for our telehealth program, which allows us to still see patients, but we see them via their telephone, via visual video conferencing, also teleconferences where we have the ability to also just talk on the phone. So we had to adjust to that overall as an organization, because as I spoke earlier, we're a health organization, and we're kind of a one-stop shop when it comes to different programs. We have a dental program, we have a primary care program, we have pediatrics, we have behavioral health, and so we have chiro. So all of those things, many of those things had to adjust to this new normal, if you will. So we were able to start our telehealth program where we met our providers, our doctors, and our nurse practitioners. They were able to meet with patients, usually via phone if you have it, of course, video. But if you didn't have video capabilities and you had telephone capabilities, we could do teleconferences via the phone. And that was, again, behavioral health. They had to adjust to that.
Mhm.
Um, even our dental program we had teledental, and so we had, of course, you can't do procedures over telehealth, but there's other things that you can do. There's other ways of examining an individual over telehealth. So, and questions that you can ask. So we had to adjust to that way. And then eventually when we opened back up the centers to be able to see some face-to-face patients. So we had to put in certainly protocols, safety protocols in place, physical distancing. I don't like to use social distancing because that's so, we so need that socialization, we like to call it physical distancing. Um, so physical distancing, and of course, mask requirements, and we hired health screeners to man the door and then take temperatures and do the questionnaires and things like that. And we've had to adjust, definitely. And one of the biggest adjustment is we purchased 5 mobile vans in order to put them out in the community, because we understood that community health workers were going to play, community health centers, and community health workers too, but community health centers were going to play a huge role in providing testing, and getting tests done. So we purchased 5 vans, mobile units. They were Sprinter vans, the Mercedes Sprinter vans, and we fitted them to be able to go out in the community and do testing 5 days a week.
Yeah, that is awesome. Y'all are y'all are doing some great things in the community. I live in Hartsville, and of course, you have a center here in Hartsville. But when I think of getting rapid testing, or when I think of testing being available, I think of CareSouth, because when it hit hard, y'all responded immediately. Y'all made it available for us to just go through a drive-through system, and it was so well done. It was so well done, non-invasive, very comfortable, safety, everything was like it should have been. So y'all did an amazing job with that.
Yeah, it was important for our CEO to make sure that we have a part in making sure folks that know their status as far as COVID-19 goes, and to work with that. And so we're excited too. So, because we're waiting on our vaccine allotment to come in. We've been fortunate enough to partner with MUSC and McLeod, and even talking with Carolina Pines to get some of our staff vaccinated. But we're waiting on our own allotment so we can start vaccinating the rest of our staff, and then opening it up to the public based on the phase levels that the state set.
Awesome. Fantastic. Fantastic. Okay. My third question, what
Wow.
upcoming events or services would you like to inform the audience about?
Like I said, the two main ones are, first, our primary care services, which is, we serve as a medical home for anyone that needs a home. Like I said, we have programs available and services available for our patients. If you have, that need their medication, we know medication is expensive, and we got community partners that we work with to get those medications at a reasonable price, as well as sometimes at no cost, right? No copay. And our pharmacy is what we call a 340B pharmacy, which means 340B is a kind of a special program that the government has, that we're able to get medications at a discounted rate. And what we do, we pass those savings on to our patients rather than pocketing that money. And we use the savings to create other programs, like programs where our iSave program, which is for patients with insurance, actually. If you have certain conditions, hypertension, diabetes, certain other conditions, rather than paying your copay when you come get your medicine, we pay your copay for you, so you get no out-of-pocket costs. That's for individuals with insurance, right? So our primary care program is still up and running, going. You need a medical home, you need a doctor, or you just want to know more about the program and see what kind of services are available along with that program. Even if you have a primary care doctor, call us, let us know. We'll run that down to you and let you know. And then the second thing is our COVID testing. Please get tested. Please stay safe, folks. Get tested. Get tested on a regular basis, at least once a month, so you know your status.
That's
That's
fantastic.
very important.
Very, very, very important. It's very important for us all to remember that this this virus is still out here.
Yes.
And that was going to be my next question to you is what advice would you have for people, and you being in the medical field with a federally qualified healthcare center, I'm sure you've seen an influx of people who've been tested positive and things like that. So please, you all, please take care of yourself. Yes, we've all been affected, whether directly or indirectly, but this thing is real and we must stay safe and do what we need to do to prevent the spread. So, that,
Absolutely.
yes.
Absolutely. And that would be my advice with everything you just said. Wear your mask, physical distancing, um, hand washing. If you're using soap and water, you want to wash your hands at least 20 full seconds. Um, using hand sanitizer. If you're out in the public, you can't get to soap and water, using your hand sanitizer on a regular basis. Gloves if that's you feel comfortable wearing gloves. Um, but it's very important, and get tested on a regular basis. Really do, because I had it.
Mm,
Me and my wife tested positive to COVID. The weekend after Thanksgiving, we found out, weren't feeling well. We found out that we were positive, and I can tell you, it's the scariest thing in the world. Especially with me, I have an underlying condition. I have a lung condition called sarcoidosis.
mm,
So the whole time I was on pins and needles. I was, like, okay, in each day, was an adventure and a thought, because, we hear about people fine one day and then the next day, boom, you
yeah.
know, yeah. And so I worried through the whole thing, but we made it out good on the other side of it. So that's my advice to everybody. Same as what you just said. Just be safe, physical distancing, understand, where you at and what's your situation in. There's an app that our CEO had made us aware of called I think it's mycovid.com app. And it helps you. It's an app that gives you, you can put in certain scenarios and it'll tell you the safety level. You know
Mm,
what I'm saying? You could say a small room, two people, and a mask, and it'll give you your safety level, whether it's a high risk, low risk, and even you can add in, if I put on the N95 mask, it'll tell you your risk.
mm.
That is a good app to use.
Wow, thank you for that resource. Awesome. This is a wonderful interview full of resources, and I'm so happy that we've had this opportunity to share. My last question that I want to ask you, Mr. Marek, um, who should they contact if they want more information, and how can they connect with you online or virtually?
All right. Let's go online, and you can reach us at our website at www.caresouth-carolina.com. I'll say that again, www.caresouth-carolina.com. You can reach out and follow us and follow us on our Facebook page, CareSouth Carolina. Also, we're on Twitter as well and Instagram. Um, you can also reach out to us at 1-866-434-9819. You can reach out at that toll-free number, or you can call any CareSouth Carolina office location. You Google us, or do we even have phone books anymore? I don't even know. I was looking at the phone book, but I don't even know. But you Google us, and any CareSouth Carolina phone number, it doesn't matter. You're in Darlington County, but if you call the McCall office number, it's gonna come back to Darlington County to our call center. So everything routes back to the call center. So any CareSouth Carolina phone number you dial, someone will pick up and be able to give you information on any center in the PD area that we have. Any information on Darlington County, Darlington County centers, that's in Society Hill and Hartsville. So that's it.
Awesome. So, ladies and gentlemen, when you ride by and you see the name Care South as you go through Bishopville or through Hartsville and you see the teal and the purple, now you know who Care South is, what
Yeah.
they do. And I thank you again, Mr. Mark, for sharing this helpful, beneficial information with us. Thank you so much.
No, no problem. Anytime. And I appreciate you. Thank you for reaching out to me. You guys have been wonderful community partner with us. So many initiatives we worked together on. So many more we're going to work on. And I thank you for this opportunity. And if y'all need anything from us, you let us know. And like I say, any information or anything, call any of those numbers there and get it to them. Okay.
Awesome. Thank you.
All right. Thank you so much.